Good morning. My name is Brad Cornell. I'm the COO with the Olathe Chamber of Commerce. Also with us from our office is Susie Carson, our Vice President of Membership Investments. So Susie will be on the screen as well today. We want to welcome everybody to our Friday Zoom meeting. We hope everyone is staying safe and continues to be well. Today's call is possible thanks to our sponsors. We have two today, DLR and Olathe Health. We will be hearing from DLR in just a minute. Olathe Health is proud to be a sponsor of today's program and proud to support Olathe Chamber since its inception. Olathe Health began with a small hospital in downtown Olathe in 1953 and now has more than 60 locations in five counties, serving the entire region with quality health care. The Olathe Chamber of Commerce is committed to providing timely, relevant information. Today, our focus is an update on Kansas education with Dr. Randy Watson. At this point, I'd like to turn this over to Kevin with DLR. Tell us a little bit about them and to introduce Dr. Watson. Kevin?
Thanks, Brad. DLR Group's an architectural engineering firm with 28 offices around the globe. Over the last 5 years, we've just done $500 million worth of design and construction in the state of Kansas from our Overland Park office. We are the #1 provider of K-12 design in the world. And I'm proud of that because we started in the heartland and we're now around the world. So I don't want to say much more because I think everyone's here to hear from our Kansas Commissioner of Education. I am going to introduce Randy though, so that everyone gets a sense of what he's been doing. So Randy hails from Coffeyville. He attended KSU, go Cats, where he earned his bachelor's degree and his master's and his doctorate. As a former history teacher, principal, and superintendent, Dr. Watson has dedicated more than 35 years of his working life to the public across Kansas. And today certainly marks something that I'm sure he never knew he would be doing. Dr. Watson has been the recipient of many awards. He's an alumni fellow at KSU, and one that I'm proud of for him is the 2015 Superintendent of the Year from my hometown, McPherson. Without further ado, Randy.
Kevin, thank you, and appreciate all that you do, and certainly DLR. Brad and Susie, thank you, and everyone at the Olathe Chamber for having me this morning. And I guess the topic is, are we having football? Oh, maybe that's not quite it, but I'm sure that's on everyone's mind too. As we face these unprecedented times, I'm just thankful for the opportunity to kind of take you through what the state board approved this week. We can talk a little bit about the governor's executive order that has yet to be drafted, but I think I can talk a little bit about that and certainly answer your questions related to how do we get students back to school in a safe and healthy way for everyone involved. I think everyone's trying to do that as much as possible. So I'm going to share a few things with you, and then we want to spend as much time as we can on some Q&A. So I'm going to go over with you in just a few minutes this document. We call it Navigating Change, a Kansas Guide to Learning and School Safety Operations. The state board voted on Wednesday of this week unanimously to accept this document that was produced by almost 1,000 Kansans. So I'm in meetings often and someone will say, you know, pick a state, North Carolina, they're doing this, or, you know, in Texas. And I look at them and say, you know, I'm all for learning about what may happen, but I know this, that when you've lived as long as I have in our state, we get to know each other, and we just roll up our sleeves and we get doing the work. And so these are a lot of educators, but parents, school board members, and the best health professionals in our state. So doctors, pediatricians, family practitioners, nurses, county health people, all helping putting this document together that I'll walk through with you in just a second. To give you an idea of how it developed, we developed this in 3 stages starting in May. The first, you're going to see a lot what we call operations and instruction. We started by, in May, grabbing CDC guidelines and Harvard guidelines and Stanford guidelines, and Maine already had their guidelines on how to come back to school. So we just collected every sample guideline for safety and school operations that we could. On an instructional side, we took the standards, the academic and social emotional standards, and we reformatted those. And I'll be happy to go over those with you in a minute. That took us 30 days all throughout the month of May. Stage 2, which just ended recently, is when we took those operations and those instructional team and we went deeper to really develop the document, make sure it was coherent, make sure it collaborated together. And then finally, the stage that we're in right now, which is rapidly ending, is 500 educators plus our redesigned schools giving advice with this document of what professional development will people in schools need in order to pull this off going forward. These are just some of the team voices on the operations side. Those are things like, do you mask, not mask? How about temperatures? How are you going to put kids on a bus and keep them safe? All of those things. And then on the instruction side, what should kids learn? Are they going to learn remotely? Are they going to learn in brick and mortar? What are they expected to learn? How will they learn? You can see the people that put those together. All volunteers. No one paid a dime. They gave hundreds of hours to this work. And so the stage 2 that just finished last week, we issued a draft document on July 9th to superintendents and county health officials. Between the 9th and yesterday, when we released this document to the public, actually released it on late Wednesday, we went through 5 drafts just in that time. And as I was telling Brad before we came on, you might not think if when you change the word shall to may or will, that it doesn't impact you, but it does. And so those things were going forward as the state board made their decision. So let me just tell you a little bit about the instructional side of this. And for those of you that are teachers, I'd be happy to go over this with you more in depth. I don't want to get too deep in this for the non-educators because people might glaze over like, well, that's great. I don't quite understand all that. So I'm going to try to keep it at a fairly high level. But the first thing that we did back in the spring was a process called continuous learning. Educators had 72 hours from the time that we knew we were going to shut school down till we did shut school down across the state to determine how will we have learning going forward. That was our best effort, but let's just be really honest. While it was really great and across the nation was called the gold standard, it left a lot to be desired because we just didn't have long enough to plan for it. So this phase is really calling for flexibility. We know that districts are going to need maximum flexibility because the virus will impact different communities differently and at different times. So for example, we know today that there are many staff members and many students that will not be able to attend a brick and mortar school because they have an underlying condition. They have an underlying health condition, or they live with someone that has an underlying health condition. So how does that work for them? What if in Olathe school there's an outbreak because 4 families went to a wedding over a weekend and there was someone positive, and then those kids had to quarantine? What happens to their education? So a flexible model that school districts can implement. And then develop what we call competencies related to the standards. They don't replace the standards. They help clarify those to a greater extent. And you'll see some of that when I go over the document, but I'm going to try to keep this at a high level for, again, the non-educators that we have. And remember, this is not an all or nothing, meaning you have to do one way or the other. It's about being flexible and having multiple learning environments as we go forward. So let's take a look at those learning environments that we think we'll have for the 2021 school year, or until we have a viable vaccination that really rids us of the risk of this virus. The first is on site. Does everyone remember when we did that? We came to school, we went to a brick and mortar school, and every teacher wants to be back in that. So when can we do that? Well, it's when the community restrictions for COVID are low or they're trending down rapidly. Schools can operate then at 100% using some precautions. We'll talk about those. You know, safety precautions like when do we use masks and sanitation and temperature checking and some social distancing. And we need to practice that where feasible. And group size and spectator events will then meet the local guidelines. And in many communities right now, that's about 45 for a large event, and some it's even greater. So if restrictions are low, for example, in Wallace County right now, there are no cases. There's not been a case yet in Wallace County, I believe. In Elk County, they may have had 2 or 3. If you're in Sedgwick County, you're rapidly running out of ICU beds. So those are extremely different situations, and that's why we have to have lots of flexibility going forward. The hybrid model. Some students are at school, some students are at home, some faculty members are at home, some faculty members in the brick and mortar. The hybrid model really happens when you're starting to see that moderate COVID-19 situations are taking place in your school district or county, and county health officials are starting to get concerned about large numbers of crowd. So in this hybrid model, schools can operate at reduced capacity, kind of like we've done with restaurants, 50%. Group size would be limited to 15, and spectator events not allowed. Now, again, these models aren't hard and fast, meaning you could be between an on-site and a hybrid model. And then, of course, the most restrictive would be remote, where students are in a remote environment where social distancing is strictly enforced. And the only students that would come to school would be small groups of 10 or less, maybe special needs kids or kids that need, you know, a lot of help could come in. But for the most part, most of the buildings would not be open. Those are kind of the 3 models that Kansans put together for this document. Now, how do you get into those? What are the considerations that should be done? We have teams of educators, county commissioners, parents, local health department officials, that we need you to get together as a group in every county and every school district. And in many of those school districts, this group has been meeting already for several weeks. In some, they may be just getting together this week, but we need broad-based groups of people working together so that we can open schools safely in Kansas once again. So some guidelines. Low restrictions would simply mean they're represented by the daily case rate of new cases by the onset date has to be low or in a steady decline. So if they're low, which we have in many of our western and especially northwestern part of the state, or you're steadily declining for the last several days or 14 days, then you can be in a low restrictive environment, meaning most of the students are in a brick and mortar. Now that does not mean that a student or a family might say, I don't care how great the county's doing, I don't feel safe. That student and family will still be a remote learner. But for the most part, in a low restriction, students will be fully in a brick and mortar environment. When we have disease spread where cases are not flat, but there's uneven, meaning some days they're up, other days they're down, and they're fairly high, bouncing around, then we'd have some moderate restrictions as we specified before. And of course, where we're seeing cases increasing over 4 to 6 weeks or on a 14-day period determined by the health department, we want to go remote learning. Today, According to Dr. Norman at the Kansas State Department of Health and Environment, 30 counties are experiencing rapid increase, rapid hospitalization. Death rates are starting to tick up. And in some communities, the hospitals, ICU beds are becoming scarce. I say that because at the same time you're hearing that, it's true. We have communities and counties with low restrictions where the virus is not spread. Kansas is a large state geographically. And while much of our state is sparsely populated, there are certainly different environments as we go forward. So our goals is to have two major buckets, keep this rigorous. We want to have academic rigor high with students and engaged on a daily basis, and we want to take care of their social emotional needs. Excuse me. And equity and access, meaning whatever environment within, every student has access to the environment that makes sense for him or her and that family. That's a really important going forward. Remember this, no environment is 100% safe. The minute you walk out of your home, it's not 100%. While there be great precautions taken for when we're in a brick and mortar to make it as safe as possible, you cannot guarantee 100% safety. And schools should maximize the flexibilities for students, for families to maximize their learning options. Finally, the call to action is go volunteer to give your voice to your local community and local school board group that are planning for the start of school. We've got several weeks to continue the planning for the start of school. It will look different in every community. Be a part of making those decisions. Give your voice, let your voice be heard. I tell people all the time, now's the time, unlike what we're doing today, get off social media, get off Facebook, get off Twitter, get off Instagram, roll up your sleeves, go out in your neighborhood, go to your neighborhood school, go to your school district office and say, I'm worried, I want to be a part of the solution, whether you're a business leader or a parent or a medical person. We want to provide training and support to our community and our teachers to get ready to open this fall, and then communicate and over-communicate your plans as to how you're going to operate when there's an outbreak in your community, what school will look like to start, what would cause it to close, what options there are for students, etc. And remember, create a flexible environment that can be done in as many configurations. We have a motto we started a few years ago called Kansans Can. We believe we are leading the world in the success of each student because of all of you. And I just want to show you very quickly, if I can, I'm going to jump to one other screen and just show you the document, and then we're going to go in, I think, to some Q&A. So here is the document. It is 1,089 pages. You can download this off our website. And Kevin, if you're having trouble sleeping at night, you start at page 1 and read till the end. But it's hyperlinked because most of you will not want to read this from cover to cover. You'll want to jump to various places. So let me just show you how it's laid out. It's laid out in grade bands for all of the educators on the call. This is laid out that you could, if you wanted, put teachers in teams of teachers so that if there's an outbreak, your team can continue to operate when you have to be remote. When a student has to be remote, you'll see there's competencies for all of the subject areas. There are assessment guidelines and assessments, and I'll get to it, there are instructional examples. So let me show you, here's some instructional examples. There are 20 examples done by the best and brightest teachers for you. And in the resources pages, there are hundreds more that you can take and modify or use as is. So here's an example. This is in a pre-K2 classroom. It's a blended flipped, it's historical hero. What can I learn, teach others about researching a historical hero? You can see the competencies are in language arts and health and music and social studies and PE and social emotional and in visual arts encompass so many. Here's the lesson plan. Here's the social emotional skills necessary to do it. Here's the who gets to collaborate, the partners of the teachers that would put this together. There's the flow of learning. Here's what the students have to do at the end to show that they've learned. Here's how you modify that for special needs students and your progression toward mastery. Every level has examples to be done for teachers. But I know all of you are saying, okay, that's nice. I'm not an educator. Tell me what those operations are. The operations make up 5% of this document. And the reason for that is if we don't get the instructional models right, we can do the operations, but we won't be able to execute the variety of instructional models that we need to do. So I'm going to jump to the operations to show you that these were done in conjunction with educators and health professionals. So let me just ask you, for those of you that know some about kindergarten students, you're a kindergarten teacher, and we say to you, the kindergartners will all wear masks starting the first day. We had a lot of kindergarten teachers say that's going to be an interesting chore because we think they may be pulling on it. And in fact, the pediatrician said, if kids are touching their face because of a mask, that's higher risk than having the mask. So you'll see some guidelines around that as we go forward. I'll just show you that. Right here, what the best practices suggest that visitors, staff, and students should wear a mask or face coverings when inside school facilities. But if you see here, it says very clearly that those could be waived for pre-K through 5th or 6th or elementary students because the doctors that helped craft this said, if you're picking at the mask, it's worse than having one. Older kids, yes. Younger kids, not as much. We're asking you to wash your hands every hour, either soap and water for 20 seconds or hand sanitizer. We've been practicing that at the state board over the last couple of days. Takes a little practice, right? To remind everyone, here's your hand sanitizer, or let's go to the restroom. So you can see a variety of things that are listed here so that operations would be safe. Classrooms, what needs to be done in the classrooms, common spaces, like how will we go to the cafeteria, or how will we go to band or music? Those create some problems for you at the high school level and everything in between. Now let me give you an example where temperature checks become a local decision. We do want staff, adults, and kids to have their temperature checked every day. We would love that. Think about this. You're coming to school at Olathe West. That's not the same as you're coming to school in Weskin Elementary School. There's a few more kids. If there's too many kids coming to school at one time, it will be impossible to take their temperatures. Otherwise, you'd only be doing that all day, and they'd be congregating, hanging out. And if they were like me, you're punching each other and grabbing each other, and that's not a good environment. So some districts may want the temperature checks to happen at home or as they get on the bus. Some may want that to happen as they come to school. So that will be part of the safety going forward. KSDEE will determine the fall sports, but there is a section there on extracurricular activities, especially as it relates to field trips, and then everything about how you transport food and how you go about feeding kids. I'm going to jump to the appendix and just show you we're asking school districts, excuse me, I'm going to get to, should have jumped right to this page, and I apologize, probably giving you all a little headache. This is in Appendix D. Here's a family survey, and if you haven't received a family survey from your district, you will be. They will be reaching out to you to ask you how comfortable do you feel about coming back to school, and what accommodations would you like to see us make. That will also be going out to staff, because your school district's going to need to know from day one who will be coming in and who may not be. And so Brad and Susie, thank you again for having me. Thanks for all of you for tuning in. Again, I'm sorry we had to postpone this a week, but this document wasn't quite ready, and I wanted to be able to answer all your questions about it. So with that, let's go into the questions and see. Maybe there's not any, and we're just going to go have lunch together, but I think there may be a few.
There are a few. First of all, Dr. Watson, thank you so much for joining us. I know I said earlier, I'm a mom with 3 kids, one high school, one middle school, one elementary. So we just appreciate the tireless effort that we know that everyone in the state of Kansas has been working for our education system. So thank you. And Kevin, thank you for joining us as well. So some of the questions that we have to get started, I know you mentioned Keisha was going to be doing the sports. Do you know what the talk is on when that might be finalized? A lot of people are asking about sports.
Sure. I mean, everyone wants to know. This is my joke, Kevin. You'll appreciate this because you mentioned I'm a K-State grad, right? Everyone wants to know about the start of football except if you graduated from KU, right? Oh, that hurt. I know. K-State, I couldn't say that when I was in school, so I have to use that all the time because we were so bad in football. They were going to release that on Friday, Susie, but what changed that is the governor has an executive order that the state board has to review next week that is asking to push back the start of school to September 9th. And I think now they're waiting to see, does that happen or does that not happen? And then they can determine, okay, are we going to be starting in mid-August or are we going to be starting in September? And so I think that decision from Kansas State High School's Activities Association will be coming probably in the next couple of weeks, I would guess.
Perfect, thank you. So you mentioned the executive order that was recently announced by Governor Kelly. Will that have a play into the school year going longer? Do we know that yet, or?
Possibly. It depends. Every school district starts the year at a different time. So we have some probably we're going to start as early as maybe August 10th or even earlier with kids. And we have some that we're starting closer to the end of August. So what the executive order says is that schools would start the Wednesday after Labor Day in order to allow some additional time for planning with this document that I just gave and allow communities really to get ready. School districts are allowed to count that professional development time with teachers as half time. So they may not have to make up any days, Susie, or maybe just a few days because they can count that time as half time going forward.
Perfect, thank you. Our next question, we've got a few questions. Does this document pertain to private schools or just public schools?
It pertains to every school that is accredited in Kansas. So all of our, so we have a lot of private accredited schools, and they were, by the way, they were part of the 1,000 people. I want to give a lot of kudos to Janet Eaton. She's the superintendent of the Wichita Catholic Diocese. She was on our oversight team, and we had other teachers and administrators from private schools. So the Catholic schools, for the most part, the Kansas City Diocese, the Wichita, Salina Diocese, the Lutheran schools, and then we have a handful of other private schools. It is not, now, our plan does not apply to non-accredited schools, Susie. They certainly can use it, but they don't have to. The executive order that the governor passed would apply to all schools, accredited and not accredited. So that's a little confusing, I think, to people, but I wanted to clarify that.
No, thank you. I appreciate that. Okay, next, so you mentioned this document was available on your website. People are asking where that is.
KSDE.org, and then click, it'll be a link right on the front page.
Perfect.
And you know what? Susie and Brad, I'll be happy to share it with the Olathe Chamber, and you can have electronic copy and you can distribute it to your membership, or if you've got some link to people that are on the call today, you can distribute it too. So be happy to do it both ways.
That is wonderful. Thank you. Yes, we will post this on our website afterwards. Thank you for that. So my next question, you talked about an online option and an in-person option. One, can parents go back and forth? If their child gets sick, can they go to the online and then can they go back? And two, is the same curriculum required in both formats?
The answer is yes, they can go back and forth. And in fact, if you've watched since March, we think they will go back and forth, either by choice, hey, I want to now come back in, or I don't because I don't feel it's safe. Or the county health says, you know what, that wing of the building is going to need to close for 14 days because we had an outbreak and those kids are going to have to move to a remote learning. So it can be both. The curriculum, so this is one of these education terms. For us, that's a very defined term. The standards in the assessment and the competencies are the same. The curriculum could be a little bit different or it could be the same. So if I'm learning like from this textbook about the War of 1812, Susie, I might learn online about the War of 1812. So the modality might change, but the content is essentially the same.
Wonderful, thank you. Our next question, so we've got, I know you referred us to the document, which goes by grades. What about libraries? Is libraries talked about in that document as well and how that should be handled?
Libraries are talked about in the common spaces, and we're going to be adding to the document about libraries, specifically about library curriculum. It will be talked about specifically. So librarians were on the teams to help formulate some of those documents I showed you. And in the common spaces, libraries are talked about, but there will be specific guidelines around the learning standards of libraries coming up as we finish stage 3.
Wonderful, thank you. Okay, we've got a few questions about substitute teachers. Are substitute teachers going to be allowed, I guess, in the building, which I'm assuming, and then how does that work? And while I'm at it, I'm going to add this question, student teachers. We've had a couple of people write in saying that they're in their final semester of student teaching. How does that work?
Well, first of all, we're glad that you chose the profession and we're excited that you're going to be a teacher. And so yes, student teachers, substitutes are not visitors. We're going to be restricting visitors. So Susie, I know you've probably been like a PTA mom and brought cookies and stuff. You're probably going to clamp down on that some because we want to stop some of the interaction, especially as you get to moderate and more restrictive environments. But student teachers, substitutes, yes, we're going to encourage that. And in fact, to all those that aren't substitute teachers, if you have 60 college hours or equivalent to associate degree or more, we'll take your application to be an emergency sub now because we need more. We'll need more going into this again as people might get ill and go in and out of this situation. So you are welcome into our schools.
Wonderful, thank you, Dr. Watson. So my next question has to do with, is the KSDA recommending to schools any changes as far as more hand washing systems in room, hand sanitizer, more ventilation? What changes are we recommending for schools to partake to help combat if they do go back to school?
Okay, so I'm going to answer a few of those. You need to go to the operations because it's all in the operations stage. So I mentioned a few of those. Recommended mask for kids in middle school and high school. Recommended mask for every adult. Recommended high PPE for nurses in a safe room if a kid is showing any symptoms or an adult showing any symptoms so we can isolate. Sanitizer, every room. Hand washing or sanitation every hour. Frequent cleaning of the classroom. So if they leave to go somewhere else, clean it. Frequent cleaning of outdoor playground equipment. Massive spacing out, let's say a band, get them outside, get your marching band spread out so the trumpet or the sax isn't blowing on someone else. Vocal music, get them in the auditorium or get them in a large space again where you can spread them out. Mechanical, bring in, and Kevin probably wants to talk about this, but most of our newer systems and are sealed systems. They're not where you can open the windows. If you can open the windows, bring in as much fresh air. Now if you haven't noticed, in July and August it gets hot and humid in Kansas, especially in the eastern part of the state. It gets more humid than in the west. But we want to bring in as much fresh air as possible in our HVAC systems, and we want to use as high of a MERV filtering system as we can that doesn't put too much of a heavy load on whatever system that's created. So we'd love to be at MERV 13 or greater. We'd love to run HVAC systems 24/7, to bring in fresh air. Kevin's, he's flipping a lid because he knows all the problems this creates. But those are the type of recommendations that we need to have. Like when you get on a bus, we want the windows to be down. We want as much fresh air coming into that bus while you're transporting. It'll be hot. will run the air conditioner. But the key is all of those things are in the operations and their guidance depending on, do you have low risk, moderate risk, or high risk? So please go to the operations part of that for more of the details.
Perfect, thank you. Okay, my next question kind of has to do with IE plans and special education services. How do we do that if those children choose the online version of learning? And if they go to school, obviously a lot of kids leave the classroom to get those resources. Will that still be an option?
The answer is the part that I talked about, every student has to have equity and access. So let me talk to the people that have special needs kids, because I have one. I have he's an adult now, but I have a student that was on the autism spectrum, and so I empathize with all of you. And some of you will have students with moderate disabilities, maybe a learning disability that can be accommodated in the classroom, and some of you have students or grandkids that are severely handicapped and require more attention. If you are at home, the IEP will be met. If you are in the building, the IEP will be met. We're going to have to, again, think about how we do it and make sure everyone's safe. So there may be tremendous safety guidelines going on, but we want to make sure we meet every student's IEP.
Perfect, thank you. Next question, they're coming in. So first of all,
I feel like this is the rapid fire round, right? How many can we get in? I love it.
You are doing great.
I'm trying to hang in there.
So there are so many things that you guys have had to think about. I've got a question about school bus transportation. That might be tricky. What considerations have we taken into that? And I don't even know, is that part of the KSDE's guidance?
Yes, it's there. The 1,000 Kansans really thought about this. Well, let me just start with busing. When we started discussing, this is so true of I call it the fight. But if you know anything about my family, that's a kind word. We like to really discuss vigorously. So originally, the safety guidelines said on a 72-passenger school bus. That's the biggest bus that you have in a school bus. You could put 8 kids on it. The school people flipped over on the ground, right? You'd be transporting kids 8 hours a day and then you'd just be taking them back home. You couldn't get them there. We don't have enough, even if we could buy enough buses, or not enough bus drivers. And so of course that had to be modified. So let me just give you a few. You're going to minimize the pickup spaces, right? We want kids socially distanced when we pick them up. Again, they're going to be masked on the bus. They're going to be filled from the back to the front. Families can sit together. Otherwise, you're going to kind of go every other and cross, and you're going to be about at half capacity. Unless, Susie, you're in a low risk area, and then you can fill it to a greater extent. So see, that's why these guidelines have to be used in your community. Kevin knows, in McPherson, we've seen a little bit of a spike, recently. Well, we weren't seeing that in the last 2 weeks. Now we're seeing it. So then we'd have to adjust our busing guidelines. And then if it starts to drop a lot, we would start to relax those. That's what makes this a very flexible, fluid plan throughout the next school year.
Wonderful, thank you. Okay, so online learning, I know we've talked about that. I've got some questions about equipment. If they're online learning and maybe they don't have access to some of that equipment. And I know it's all about resources, but what are some options that you're giving schools there, or guidance?
Equity and access is important. So if we're going to require, right, that's different than I'm choosing. If I'm choosing to go remotely, I may have to provide my own equipment. But if I'm requiring you because you have to be quarantined or we have to shut down for a brief period, and we're going to go remote for everyone, school districts should be able to provide that equipment. Now, the issue you're going to get into are services. Do I have internet in my house? So I know school districts are buying hotspots to try to provide for that. I know we're working with Senator Moran right now to do some broadband, have some additional funding that might roll out by the end of July to increase broadband services, to not so much to schools, but to families, especially we think in our rural areas, but I know talking to Wayne Burke in Spring Hill, for example, there are pockets in Spring Hill in that school district where internet service is not good. And so I think oftentimes we think, well, it's in a very remote part of our state. So that's a little bit trickier, Susie, because we don't have total control over that. But certainly a device like a Microsoft Surface tablet or an iPad or a Chromebook and maybe a hotspot, I know school districts have worked really hard to make sure those will be available to students.
Wonderful, thank you. So Dr. Watson, kind of a question for us. Of course, for the Chamber of Commerce, the workforce development is important. Are you working with local universities with this KSDI guidelines to ensure that our students are still getting training to go into the workforce?
Yes, and I thought after football, Susie, I thought the second one was going to be related to my kids taking dual credit or vocational classes, and colleges are going to go earlier. What's going to happen in that August? So let me address that first, and then let's talk about workforce. So if you're a student, junior, senior primarily, are going to be taking dual credit classes and or taking vocational technical classes at a community college or technical school, if the governor's executive order goes in place, it is okay to transport those kids to the community college or the vocational college prior to school opening. So I just want to make that clear. You know, from a workforce development standpoint, we want all of our students to have an individual plan of study that meets his or her aspirations of what they want to do, and we want to execute that. So we need a closer collaboration with business. We need more internships and job shadowing. Those will still take place, but they may have to be limited. And some of that, like we're doing today, we can't meet face-to-face. We're having to Zoom. So some of those may have to take a little bit more of a remote presence. Again, it will depend on the community. If the community's in low risk, we can be face-to-face a lot more than we can if we're in a high-risk environment.
Wonderful, thank you. All right, we've got just a few more because I know you're just answering these like crazy. Let's see.
I'm waiting for the easy ones. When are the easy ones coming?
No, thank you so much. Like I said, we greatly appreciate everything you're doing. So I've got a few questions about, and this is probably between the districts, I'm guessing, but one, are the districts communicating? Of course, so many of these actions are left up to the individual district just due to the differences across our state. Are they communicating between districts what they're doing? So parents, obviously, especially up here in the KC metro area, one district is right next to another. So how is that communication going?
Well, I could not speak to how every district's communicating with parents because other than my own, where I live in McPherson, I could speak to that because I might receive that information. I know that school districts though are collaborating. For example, the Johnson County superintendents are collaborating. I know that I'd say weekly, and John Allison would probably say, Randy, it's daily right now. But I know they are collaborating, and the greater metro area soups are collaborating. They're on Zoom calls with school districts of like geographic areas and like size, in trying to say, hey, what are you doing here? What are you doing here? And that's taking place and has been taking place for quite a while, and it will intensify over the next several weeks.
Perfect. Okay, last question, because I'll be honest with you, we have probably got over 90 questions, so I hope that I've hit some of them. Our last question is with state assessments. How is that going to be with the different changes that we've seen throughout the school year?
I think that's too early to tell. Okay. We certainly want to measure learning. We don't, you know, you've heard me speak. I think whoever's asked this question, state assessments are not the end all be all, but we need to measure academic progress. We can do that in many ways. When you look at the document, we have rubrics to measure that, the highest of levels. We'll be making the decision on state assessments probably around the January timeframe, December, as we see, are we going to be in school all year? Is our vaccine coming forward? What that looks like. But if we're interrupted a lot, you know, obviously we're going to be in a phase like we were last year. If that interruption's minimal this year, then, you know, we're probably going to go forward with that.
Perfect, thank you. And just one more thing for everyone that's watching, I've got a few questions asking about this recording. It will be available on our website, www.olathe.org. I know some people have joined late and didn't get to see the whole thing, so please look there for the document and the recording. So Brad?
Thank you, Will. Again, thank you, Dr. Watson, for your time this morning. The great information. You did a wonderful job. Think of how busy this gentleman's been this week and to take out time to join us today. So that's great. So thank you again. As Susie said, the video of the call will be available on our website. So next Friday, July 24th, we will have a Royal spokesperson provide an update on their season. That day happens to be their scheduled first game, not a home opener, they're away, but still that's their first scheduled game of the season. So that'll be great. Once again, we want to thank DLR, thank you, Kevin, and Olathe Health for sponsoring our call this morning. Thank you again for joining us today, and everybody have a great weekend. Thank you.